Hello, my name is Jazzy RN. Welcome to my channel. If you're new here, welcome. If you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. This first company is with Payor Health, and they're hiring a bilingual nurse navigator. This is for Puerto Rico, and this position must be based in Puerto Rico and have an active unencumbered RN license in Puerto Rico. In addition to licensure in one or more U.S. states is a huge plus. This position entails working 2 p.m. to 10:30 p.m. shift, 5 days per week, including alternating weekends. And just an FYI, it is normal to work not only alternating weekends, but alternating holidays as well. What you will bring to the table regarding the position is 2+ years of clinical hospital experience, working as an RN, an active unencumbered RN license in Puerto Rico, minimum of associate's degree in nursing, be a permanent resident of Puerto Rico. Fluent in spoken and written English and Spanish is required. All applicants must submit a resume in English to be considered. And prior call center experience is strongly preferred. The next position is with Meditech. This is a nurse case management senior analyst. This was posted on April 6th. The job is contract 40 hours per week, and the schedule is from 9 a.m. to 5 p.m. Monday through Friday, weekend work if needed, and the pay range starts at $45.50 per hour. This position requires you to have active unrestricted RN license, a clinical case management and utilization management experience reviewing inpatient care admissions and levels of care, strong clinical judgment and ability to work independently, comfort managing a full caseload with forward planning and prioritization, excellent communication and collaboration skills. Health First is hiring an appeals and grievances clinical specialist. The job is remote, state is New York, and for this job, the position has 2 schedules available: Monday through Friday, 8 a.m. to 5:30 p.m., or Wednesday through Saturday, 7 a.m. or 7:30 a.m. to 5 p.m. or 5:30 p.m. The qualifications are RN, LPN, or dental hygienist. Preferred qualifications are bachelor's degree, experience in clinical practice with experience in appeals and grievances, claims processing, utilization review or utilization management or case management, demonstrated understanding of utilization review guidelines. It is NYS ART 44 and 49 PHL, Interqual, Milliman, or Medicare local coverage guidelines. I'm going to pause right there for a couple of minutes regarding Interqual and Milliman. You can get certification for either or by doing a Google search by typing Interqual certification or Milliman certification. So just a FYI, if you go to the description box below, you'll see a link that will take you here, which is Cure the Bedside Burnout. And the first part of this link, this site is a list of over 90 companies that hires nurses to work remotely. And most of these companies are United States companies that hires nurses in the United States. There are some companies that hire nurses internationally, as well as Australia, Canada, the Philippines, etc. If you want to scroll down the very bottom of this list, you can and see more of the page. But if you want to quickly navigate to resume tips, which is here, it will bring you to this page. Let me go back up to the very top. So first, I'm going to start off right here where it says resume tips. I do suggest you add platforms. The platforms is what make your resume look more tech savvy. So anything you know about Epic, Microsoft Office, any software or platforms you've used on the job currently, your current job or previous job, you want to add that to your resume. Also write your resume with this in mind: what you did, why it's important, and how it relates to the job that you want. And here's an example I created here. This is regarding how a bedside nurse skills is transferable to an insurance nurse skills. And also, insurance nurse could be not only utilization review or management, it's also considering including appeals. On the right-hand side is a template of how my resume is set up. I do highly suggest that you use present tense for your current job and past tense for your previous jobs. The next part is how a bedside nurse and an insurance nurse is similar and a little bit different. But whatever you do with the bedside is very much transferable to what is done as an insurance nurse. So here you see a diagnosis, bowel obstruction. Now the patient is for a bedside nurse, a member is for an insurance nurse. And let's say the radiology tech performs abdominal and pelvic x-ray. The results are read by the radiologist and it comes back as a CT positive for bowel obstruction. The doctor orders an NG tube suction, IV fluid to 100 cc's an hour, and NPO. On the insurance side, the insurance nurse looks at the authorization, which is similar to the charting using Epic or Meditech, etc. on the bedside nurse's side. So the insurance nurse will use interqual. This is my example. I have this one memorized for bowel obstruction. So for the interqual criteria, in order for the insurance nurse to approve the authorization or the clinicals, which is what it is documented and charted in the patient's chart, must show an imaging positive for bowel obstruction. Doesn't matter where the obstruction is in the bowel. The patient must be NPO, NG tube dissection, and continuous IV fluids. All that criteria is met, and now the insurance nurse can approve. And if you look down here, where it says what you do as a bedside nurse directly relates to what is reviewed by an insurance nurse. And where does the insurance nurse obtain clinical? From the hospital. The clinicals are charting done by the hospital staff. That includes the nurse, the CNA, the doctors, the radiologists, etc. Now here is where you get your interqual and MTG certification. I'm not being paid by them to promote their products. I'm just offering you information regarding how you can make your resume more marketable for a remote job. Let's say if you want to work in utilization review or utilization management or appeals. So interqual certification, you'll go to this website here, and I would suggest to use the if you were to buy the workshop or webinar, this is the one I would purchase. I've never bought any of their webinars, but the jobs I've worked for, they have trained me to use both interqual and MCG. So for interqual, this one is interqual level of care acute. And for MCG, I would suggest the MCG Care Guidelines Specialist Certification. ISC is for inpatient and surgical care, and GRC is for General Recovery Care Guidelines. So back to the job description. Ability to work independently on several computer applications such as Microsoft Word and Excel, as well as corporate email. Most likely that's going to be Outlook, and then virtual filing system. Their system is Maxess, and experience with care management systems such as CCMS, TrueCare, and Highland. Demonstrated ability to manage large caseloads and effectively work in a fast-paced environment. Hiring range, this is for people or nurses in the New York, New Jersey, Connecticut area or states, 83,000 to 120,000, and other locations, that's within approved locations, is 73,000 to 108,000. The next position with Health First is a behavioral health care manager, HARP. It's fluent in English or Spanish and Spanish. The job is remote, and the qualifications are a New York RN, LCSW, or LMSW. Preferred qualifications include strong interpersonal and assessment skills, especially the ability to relate well with seniors, their families, and community care providers, along with demonstrated ability to handle rapidly changing crisis situation. Fluency in Spanish, Korean, Mandarin, or Cantonese. And just remember, this is preferred, not required. Knowledge and experience with the current community health practices for the frail adult population and cognitive impaired seniors. Knowledge of interqual and LOCADTR locator. Experience managing member information in a shared network environment using paperless databases, database modules, and archival systems. Experience and knowledge of the relevant product line. Relevant work experience, preferably as a care manager. Demonstrated ability to manage large caseloads and effectively work in a fast-paced environment. Proficient with simultaneously navigating the internet and multitasking with multiple electronic documentation systems. Experience using Microsoft Excel with the ability to edit, search, sort, or filter, and other Microsoft and PHI systems. And you can learn this by either Googling or using Microsoft Excel's website and see if they actually have any courses on there, as well as LinkedIn Learning and YouTube. The hiring pay range for New York, New Jersey, and Connecticut residents is $83,000 to $120,000, and all of the locations All other locations within approved locations is $73,000 to $108,000. This next company is Privia Health. They're hiring a remote health advisor. And this position, the candidate must have relevant clinical experience and or be a certified EMT, emergency medical technician, or medical assistant, MA. So the qualifications once more: certified emergency medical technician or medical assistant, preferred 3 to 5 years of experience. Prior experience in an outpatient healthcare setting is strongly preferred. Experience with electronic medical records systems, proficient in basic technology platforms with the ability to navigate multiple systems. The hourly range for this role is $20 to $23.80 in base pay and exclusive of any bonuses or benefits. And this role is eligible for an annual bonus targeted at 10%. Base pay offer will be determined based on relevant factors such as experience, education, and geographic location. Now, in order to successfully work remotely, supporting our patients and providers, we require a minimum of 5 megabits per second for download speed and 3 megabits per second for upload speed. And here you can go here to this website, speedtest.net, to measure your internet speed online. And you can actually work with your internet provider to have questions answered about your connection. Also, employees who regularly work from home offices are eligible for expense reimbursement to offset this cost.